Welcome back. This is the continuation of the National Health Career Association Pharmacy Technician Exam Preparations. Introductions. Lesson 1, Part 2. In this Lesson 1, Part 2 of the basic overview, we will discuss about pharmacy department layout. At the end of this lesson, you are expected to understand and follow procedures in regards to pharmacy workflow in a typical pharmacy department. The pharmacy department, whether in a community or hospital setting, is managed for efficiency. Equipment, products, and workstations are located for convenience, accuracy, and speed. Depending upon how many prescriptions your pharmacy department dispenses, you may have several types of staff members attending to these duties, but managing not to crowd each other in this process. The staff may include pharmacy clerks, pharmacy technicians, pharmacy interns, and the pharmacist itself. To maximize function and workflow, the pharmacy department is divided into two areas. The first one is medication storage area, and the second one is the dispensing work area. Medication storage area. In this area, there are three things to look for. One is medication bays, which are arranged alphabetically by brand name, and they also are arranged by package size or dosage form. Also, you can find speed shelf in this area where medications that are sold quickly are stored, and also a refrigerator is found in this area. There should not be any food kept in this refrigerator, just for medications only. The medication storage areas are usually a U-shaped shelving units on which medications are kept. These bays, as they are known, are arranged so you or pharmacists can reach more medications with fewer steps, thus reducing the time needed to fill prescription. I would like to discuss the arrangement of the medication bay. This arrangement can be found in various combinations among pharmacy department. The first arrangement is by alphabetical, by brand name. Medications may be simply be arranged from A to Z according to the brand name. Generic drugs are usually placed immediately beside their brands, although some pharmacy department might also turn the generic medications into alphabetical order. The second one is by package size or dosage form. Arranging oversized packages, for example, 1-gallon bottles, or undersized packages, for example, the eye drops, on their own shelves saves space. Some pharmacies separate some dosage forms, for example, the topical creams and ointments, from other stock and alphabetize them by brand name. Like we discussed earlier on, speed shelf is one of those things found in medication storage area. They are located in dispensing area. These shelves hold medications prescribed most often. This area is sometimes called the faster mover section. These medications are dispensed repeatedly during the day. Therefore, the product package are kept nearby for easy and quick access. But some pharmacy department locates each shelf above their work counter where prescriptions are filled. Other pharmacies department use the narrow shelving units at the end of the U-shaped medication bays. Another thing found in the medication storage area is the refrigerator. This refrigerator contains medications such as insulin and liquid antibiotics that must be kept cool until it's being used. Food, like I said earlier, should not be stored in the same refrigerator with medications. Some efficient workflow helps pharmacists dispense prescription more quickly with a minimum of errors. Work generally flows in one direction along the prescription counter. Each part of the counter has its own specific function. So in this section, I will describe these work areas and typical workflow behind prescription counters. This area includes in window, out window, data entry area, the dispensing area, other areas, pickup area, administration area, and OTC area. Then we have the clean room. I will start by talking about the in window. This is a counter area where you greet patients and obtain patients information about new prescription and refills. Is sometimes called the in window. Because this area creates the patient's first impression of the pharmacy store, you are asked to keep it clean and uncluttered. It should be free of signs of displays or supplies that interfere with patient services. Another area of significance is the out window. This is a counter area where pharmacists consult patients and you or member of the staff complete the sales transaction. It's sometimes called the out window. Also keep this area uncluttered since patients need room to sign various forms and write checks. Some pharmacy departments have only one counter or window which they use as both in and out window. Others have a separate counseling area with more privacy to discuss um, confidential matters for their patients. The data entry area is the workstation where the computer is located. Sometimes this area is next to the in window, like we discussed earlier. Here you enter information into patients' profiles. Prescription labels are prepared on a printer located in the dispensing area, which is described later on. The data entry area has three functional components whose specific arrangements in the pharmacy may vary depending on the pharmacy. The first one is called to be entered section, and the second one is called to be filled section, and the last one is the staging section. In the to be entered section, this is located next to the computer and the host prescription forms until they are keyed into the computer. To reduce patients' time, prescription forms for patients who are waiting are placed ahead of prescription forms of patients who will return later to pick up their medication. The next data entry area to be discussed is called to be filled section. Usually, a racking or filling system is organized by pickup times. Prescriptions are prepared by working your way through this file according to pickup times. Um, the filing system organizes your work and it helps assure that prescriptions are ready when patients expect them to be. The other data entry area we're going to discuss now is the staging section. This is the counter space next to or near the dispensing area. The label original prescription order and stock bottles of medications to dispense are placed in this staging area. The next area in the pharmacy we're going to talk about is the dispensing area. Yeah, this area is a part of the counter space where you count, pour, and package medications. Keep this area well organized and clutter-free. Only equipment needed to dispense medication should be allowed in this area. Mix-ups here are a serious matter. Um, Things I can find over there is the counting equipment, a distilled water dispenser, auxiliary labels, a calculator, and prescription containers. In the dispensing area, a counting equipment is pretty much visible. These counting trays and automatic pill counters are located here. This equipment described later in this course varies among pharmacy stores or pharmacy departments. Also in the dispensing area, we have distilled water dispenser. This is usually located near the work area. Distilled water is usually added to pre-measured powder to create a solution or suspensions. These reconstitutables, usually antibiotics, have short shelf lives after water is added. They often require refrigeration. Another thing we find in the dispensing area is the auxiliary labels. These provide written reminders to patients medications such as take all medications, do not mix with alcohol, or take with food or milk. These auxiliary labels come in rolls, much like you know how we have these postage stamps, and are kept in a dispenser in the work area. Of course, also found in the dispensing area to be used is a calculator. It comes in handy to compute a dosage amount. Another material found in the dispensing area is called the prescription containers. These are usually stored within easy reach under the prescription counter. The less frequently used ones are often stored nearby. Other areas where you will work are storage areas, administrative area, clean rooms, and the front of the store. Specifically, this area is also part of the pharmacy department. The pickup area. This is a group of bins or baskets where finished prescriptions are wait to be picked up. Prescriptions are usually stored in the bins alphabetically by patients' last names. Administration area. This is used to complete paperwork and to check in orders from suppliers of the pharmacy. Over-the-counter area, or popularly known as OTC. This area contains non-prescription medications. It is typically located close to the prescription department to make it easier for the pharmacists to recommend specific products or answer questions about OTC products. Clean room. I call it the special room. This is a controlled environment for compounding sterile products in hospitals and other pharmacies that provide home infusion services. They use laminar flow hoods, which we will describe in this section on sterile product compounding, are located in this area. Thank you for watching. Don't forget to subscribe to my channel for more video training lessons. And if you want to get extra help, you can click below and go to my website and get other lessons available for free for your own pleasure. Bye bye.